Make it make sense, your kidneys. The mnemonic I want you to remember kidney function is a wet bed. Our A stands for acid-base balance. So our kidneys are our main organ when it comes to buffering or maintaining pH homeostasis in our body. So you might remember your ABGs. When we're looking at metabolic issues, we're looking specifically at our kidneys. Are we retaining or excreting bicarb? When we have strong acids in the body, bicarb neutralizes those acids and forms carbonic acid. Carbonic acid is further managed by our lungs, and it becomes, or it's dissociated into carbon dioxide and water. With metabolic acidosis, my bicarb levels are low. I don't have enough bicarb to neutralize acid. With metabolic alkalosis, I have way too much bicarb. Our W stands for water balance. Our pituitary gland secretes antidiuretic hormone, ADH. Remember it like anti-pee hormone. If I have too much anti-pee hormone, ADH, guess what? I'm not peeing. That's where I end up with problems like the problem SIADH, syndrome of inappropriate antidiuretic hormone, too much of it, so I'm soaked inside. If I have low levels of ADH, low levels of this anti-pee hormone, nothing's telling me to stop peeing, so I pee way too much. This is where I see diabetes insipidus. DI, just remember, I'm dry inside. The E stands for erythropoietin. So this is a hormone that is secreted by our kidneys that goes and says, hello, bone marrow, I need you to make more red blood cells. So in patients like with chronic kidney disease or with end-stage renal disease, they are not producing enough of this hormone, erythropoietin. That's why we end up with issues like anemia. It's very common to give these patients the medication epoetin alpha or a synthetic form of erythropoietin to help their body make more red blood cells. Our T stands for toxin removal. We have a lot of toxic waste in the body. Nitrogenous urea. Now, you might hear that and be like, that kind of reminds me of my BUN. Blood, urea, nitrogen. How much nitrogenous waste do I have in my blood? This is why when your patient is in CKD or ESRD, our BUN is high. That makes sense. It's toxic waste. It goes higher because the kidneys are not excreting or removing the toxins the way that they should. We also have ammonia. Too much buildup of ammonia when our kidneys aren't working could cause encephalopathy. This is where a patient could be lethargic, could end up with seizures. Children might complain of a headache, especially if they have acute glomerulonephritis. The best indicator of kidney function is going to be our creatinine. So creatinine is a byproduct or an end product of protein and muscle metabolism. But why is it the best indicator? Because our creatinine only goes up when we've lost about 50% of our kidney function. How are we going to remember this? If you're a gym goer, or maybe you saw the craze about creatine powder to help you build muscles and recover. So creatine, broken down, you can think creatinine. High levels of creatinine, my kidneys aren't doing well. The B stands for blood pressure control. You might remember your renin, angiotensin, aldosterone system, or you might remember the fact that your body has to either keep sodium, excrete potassium, and remember, where sodium goes, water flows. So if I have high levels of sodium in the blood, guess what? You're going to hold on to a lot of fluid. This raises your blood pressure. Blood pressure is also controlled because on top of our kidneys, we have our adrenal glands. And our adrenal glands secrete two things: glucocorticoids, like cortisol, cortisone, and mineralocorticoids, like aldosterone. Aldosterone helps us achieve electrolyte balance. It kind of tells our kidneys, keep on to the sodium or let some of it go, or it tells our body, keep or let go of extra potassium. Our E stands for electrolyte balance. So kind of like same thing, we're just building upon it. Do we keep or let go of sodium? Do we keep or let go of potassium? And etc. Our D stands for vitamin D synthesis. Now think about it. When you go to any store and you're trying to buy a supplement, you're trying to buy calcium. Typically calcium is like calcium plus vitamin D. This is because vitamin D helps your body absorb calcium. If our kidneys are not functioning properly, we are going to end up with hypocalcemia. So what can we give our patient to help them absorb more calcium? A medication called calcitriol. So calcitriol is a synthetic form of vitamin D. If I give my patient a synthetic form of vitamin D, I'm further helping their body absorb more calcium since their kidneys aren't doing it. Like I always say, make it make sense. If it doesn't make sense, you're not going to understand the disorders. We're not here to memorize. We're here to understand. Let me know if you want a part 2 covering kidney function labs in a way that makes sense. And follow for more.